how much lengthening can be done in tibia or in femur? This is the question whenever you are planning for limb lengthening or you have undergone the limb lengthening. This question always keep on striking you. Or when you are going for this life-changing surgery, structure limb lengthening surgery, you always want that you can gain maximum. But it depends on a lot of factors, and we are going to discuss those factors today. Hello friends, I am Dr. Sunil Saini, trauma neurosurgeon, expert in limb lengthening, deformity correction and pain management. So whenever planning for limb lengthening, especially cosmetic limb lengthening, because this question will not arise in case of limb length discrepancies. In limb length discrepancies, as we know that one limb is shorter than other, so we know how much target we need to achieve. We need to achieve the target so that our limb get equal. But this question basically arises when you want to go for structure limb lengthening, as it's a life-changing decision. So you want to gain maximum as much as possible, but every desired length cannot be achieved every time. As I always say, it is better to achieve 1 centimeter less without any deformity than gaining 2 centimeter extra with deformity, with difficulties, and then rehabilitation become prolonged and you are having difficulty in doing your day-to-day activities. So now we will discuss segment by segment how much we can lengthen. As far as scientific thing is concerned, as far as the research is concerned, and as far as all the data is concerned, over the period we have seen that scientifically it should be 20% of your pre-existing limb length. For example, if your tibia is 30 centimeter prior to surgery, then 20% of that is 6 centimeter. So you can go for 6 centimeter, but it is not fixed. At 6 centimeter you need to stop the lengthening. For example, if your muscles is allowing you have achieved 6 centimeter of lengthening, but still after examining, your physio examined, your doctor has examined, and we found that the limb is still flexible, there is no tightening of tendo Achilles, then definitely you can go for further. But the point where we see that the tendo Achilles is getting very highly tightened and there is chances of development of deformity, especially ballerina syndrome, then it's the point where we should stop. And at this point, it is not important that we should always apply 20% rule. So on an average, when we go for tibia, it is 5 to 7 centimeter of lengthening, usually which can be achieved without any complication or without very serious complications. Sometimes there is tightening of tissues, but that can be very well managed with the help of physiotherapy. So in tibia, the average length which we can achieve without any complication or without any much complication is 5 to 7 centimeter. I'm not saying that you cannot go beyond that, but definitely you cannot achieve 9 centimeter or 10 centimeter in tibia, where some of the channels are saying that they have achieved 9.5 centimeter, but definitely that can lead to deformities. And it also depends how flexible or how tighten your tendon is. If your muscles is allowing that thing, the tendon is not too tight, definitely you can go for further. But achieving 9 centimeter or 10 centimeter in tibia is like an impossible thing. Even Dr. Dror Pele has always said that 5 to 7 centimeter or max you can go for 2.5 to 3 inches can be achieved. But beyond that, sometimes difficulty and there is deformities are going to happen. So in tibia we can go for 5 to 7 centimeter. As far as femur is concerned, because femur is a long bone, very much stabilized by a lot of muscles and with a good vascularity, and is a weight bearing long bone, we can go much beyond that. So in femur, usually 8 to 10 centimeter of lengthening can be achieved, but always we cannot go for 10 centimeter. For example, your femur is 40, then you can 20% of 40 is 8 centimeter. So on an average, 8 to 10 centimeter of lengthening can be achieved in femur. But the point for femur is also same. If patient is having neurological problems, like most of the time what we have seen when we go for femur lengthening, when we are going beyond that, your tissues get very tightened and there is chances of pressure over a sciatic nerve, then you may develop tingling numbness. So we need not to reach that point. So in femur, the average length which can be achieved is 8 to 10 centimeters. So those individuals who are looking for 8 to 10 centimeter of lengthening in single go, then femur can be a better option. But we need to compare your proportionate length also, your tibia as well as your femur. If your femur is already very disproportionate as compared to tibia, then it will not be wiser option to choose femur, then we need to choose tibia. And if your proportionate is almost normal, equal, not so different, then we can choose for femur. So in femur, average length which can be achieved is 8 to 10 centimeter. In tibia, the average length, height which can be achieved is 5 to 7 centimeter. I am basically talking about without any complication or without not so serious complications. Mild deformities or mild stiffness can happen, which can be very well corrected with the help of physiotherapy. So friends, it was in short how much lengthening you can achieve, especially in tibia as well as femur. The general rule is 20%, but we can go beyond that also if your muscles, your tissues, your tendons is allowing that, and that need to be examined by your physio as well as your surgeon who has done the surgery. So you need not to become rigid that I want to achieve this much only, or I want, like you have a target of 8 centimeter and at 6 centimeter of tibia lengthening there is deformity, there is stiffness, the tendon Achilles is too tightened. It's the time that you should stop your lengthening at a time, otherwise the deformity will happen, and thus deformity is going to affect you lifelong, and then you will keep on cursing the surgery. Similarly, things for femur also, whenever there is tightening, where there is neurological symptoms are developing, we need to stop this. So friend, this was in short about how much lengthening we can achieve in different segments like tibia as well as in femur. So friends, if you are looking for limb lengthening, if you are looking for structural limb lengthening, if you have any deformities, if you have any limb length discrepancies, if you have genu-valgum, genu-varum deformity, you can contact us. You can send your reports, you can send your queries, and if you are having any other musculoskeletal disorders like sciatica, cervical spondylosis, tennis elbow, frozen shoulder, if you have any sports injuries like meniscus injuries, ACL injury, deltoid ligament injuries, for all those musculoskeletal conditions, you can also contact us, you can send your reports. And we are doing all this surgery at our Global Hospital Trauma Center, Pataudi, and I'm happy to share that now we are a NABS certified hospital. So please like our video, share our video, and subscribe to the channel. Thank you so much.